Welcome to Business Innovators Radio, featuring industry influencers and trendsetters sharing proven strategies to help you build a better life right now.
Welcome to the show. I'm your host, Ken Sherman. With us today is a returning guest, Dr. Anthony Pivonka from Pivonka Family Chiropractic. Dr. Pivonka is obviously a chiropractor, but he works in many different modalities to help his patients achieve optimal health through diet, rehabilitation, and exercise. He's with us today to talk about the types of chiropractic care available to patients and to help us understand what terms like chiropractic biophysics and corrective chiropractic are and how they can help. Welcome to the show, Dr. Pivonka.
Thanks for having me, Ken.
So, Dr. Pivonka, tell us a little bit about your practice, how long you've been in practice, and the types of treatments you provide.
My wife and I, we practice together. We've been in practice now about 22 years. We provided within our practice care for basically everybody from the womb to the tomb. We take care of infants to the elderly, and everybody in between. But we focus a lot on structural work, which is, I guess, would be best paralleled to orthodontics. In the dental realm, we're kind of like orthodontists within the chiropractic realm.
What has changed in the profession in the time you've been practicing?
Well, when I first was in chiropractic college, we focused a lot in school on helping people with their pain. It was mostly just a kind of a patch mentality, which would mean, you come in with a symptom, we would adjust you, make you feel better, and then, we'd send you out. There really wasn't anything that would correct a problem in a person's spine. And then from what we've learned over the last 20 years is that the reason that most people have pain and disability with their spine is because they've got some sort of a structural problem that isn't being addressed. And so that's kind of what's changed over the last 20 years is there's a little bit of a shift going on within the profession away from just treating people's pain and disability and moving more towards actually correcting the structure of the spine and trying to fix a person's overall structure to improve their overall function and quality of life.
So it sounds like there's different methods or different methodologies that chiropractors can use to help patients. Are there different types of chiropractors at all, or does everyone get essentially licensed to be a chiropractor and then specialize in a certain area?
No, there's many methods within the chiropractic profession to take care of patients. Some of them are researched and validated. Others are kind of more esoteric and not so much researched. But there are people within the profession that treat neurological issues. There's other ones that focus mostly on kids. There's definitely a group within the profession that focuses on athletes and treating like professional athletes and Olympic athletes and golfers. And that's all fine and dandy. Our focus is basically just structural work, trying to improve the overall shape and structure of the spine.
And my guess is that's where chiropractic biophysics comes in. I've heard you talk before about chiropractic biophysics and corrective chiropractic. Can you explain a little bit more what that is?
Sure. Corrective chiropractic basically is just what it says. We're trying to correct a problem. And so chiropractic biophysics is a method that is specifically geared towards corrective care. Chiropractic biophysics came about probably 35, almost 40 years ago. It was created by a doctor named Dr. Don Harrison, who was also a PhD in mathematics and a master's in engineering. And his philosophy was, if we're just going to treat pain, we're really not doing much for a patient because they're going to keep coming back continually again and again with the same pain, with the same problem, and eventually their spine's going to wear out to the point where we can't help them. So, he was like, why don't we just try to fix these structural problems and make sure that people's spines actually last a lifetime? So very much looking at it kind of like from the dentist perspective. You go to the dentist, you brush, you floss, you see the dentist, you get your teeth cleaned, you have your cavities taken care of because you're trying to attempt to keep your teeth as long and as healthy as possible. But people don't take that same approach with their spine, which they should. So we're kind of trying to get that more within the profession now. We're actually trying to encourage people to take good care of their spine. And if they have a problem, to get it fixed. And that's what chiropractic biophysics is all about. It's basically orthodontics, like I said earlier, in the chiropractic perspective. We're trying to move the spine from point A to point B, get it to a normal.
What makes chiropractic biophysics and corrective chiropractic unique from other forms of chiropractic care?
Well, it's just a focus. Our focus is structural improvement. So all of our methods have been researched. Our actual research group has defined a normal position for the spine that's now widely used within the orthopedic literature for spinal surgeries and orthopedic type of rehab. So there is a normal position defined for the spine. And so any deviation of the spine away from that normal then is termed abnormal, and abnormal doesn't function as well as normal does. And so chiropractic biophysics within this profession is the most researched method, most scientifically validated method, and it seems to be kind of more the method that actually makes more sense as far as taking care of patients long term. It's not so much just a patch and come in when you hurt type of thing. It's more of a let's find out what your problem is, let's structurally fix it, and let's make sure it doesn't come back.
Is there additional education required to be a corrective biophysics chiropractor?
Well, currently, chiropractic biophysics is taught in, I believe, 6 of the 16 chiropractic colleges within the United States. So you can get an intro to chiropractic biophysics within a school atmosphere. There's a couple schools that actually allow clinicians to practice chiropractic biophysics in its true form. Other schools basically just give you intros to the method. And then once you graduate, you have your basic education, then you have to go out and kind of figure out what you want to do. And so there is extra education in the chiropractic biophysics method. There's a basic certification, there's an advanced certification, there's also a fellowship that can be achieved. And so it's basically about 180 extra classroom hours beyond school for these certifications, and then to get a fellowship, you have to pass tests. And so it definitely requires more schooling.
So you went and took all this extra schooling to become what they call a CBP chiropractor. What types of problems can corrective CBP chiropractors help with?
Well, one case I always like to kind of keep as an example in the back of my head is I had a patient that came to us. She had 5 lower back surgeries, starting at the age of 17 after a cheerleading fall. And so she had rods and screws implanted, and the rods and screws just kept failing. The rods would bend, and the screws would actually pull loose from her spine. And her orthopedic surgeons and her physical therapists and her other chiropractors could never figure out what was the problem. And so when she came to my office for analysis upon referral from a dentist, I looked at her, I evaluated her posture, and that's what chiropractic biophysics looks a lot at. We look a lot at posture, we look a lot at structural films of the spine. And I looked at her posture and I looked at her x-rays, and I was like, I know exactly what your problem is, and it's something that no one else has ever looked at, and that's that she had a structural anomaly in her leg length. Her right leg was actually about 1 inch to 1.5 inches shorter than her left leg anatomically. So her pelvis then sat with a big slant to it, which then caused her spine to have to bend in order to hook up to her tailbone. And so if you take somebody and you got them on an operating table and you put straight rods in and screws and put everything together, as soon as she stands up, gravity is going to try to, go the way it needs to go, which is downhill. And so hence that's why her surgeries are always failing. And until I found that, until I took a look for that, even her surgeon wasn't even aware of it. But once she had her last back surgery, her 6th and final back surgery, they actually accommodated for that by bending the rod to fit the shape of her spine. And since then, she's had a successful surgery and a successful outcome. So that's where it makes chiropractic biophysics doctors a little more special. We're actually going to take a very thorough evaluation of your spine structurally and compare it to norms, and then look at the research as far as how does that norm and how does your spine compare to the pain syndromes you may be having, and then try to fix that. So if you have no curve, no cervical curve, no curve in your neck, you're going to be more prone to headaches, more prone to neck pain, more prone to arm pain. So we know what types of spines produce what types of symptoms, and so we can evaluate those patients effectively and treat those methods. So it's just kind of like another step up the rung from just traditional chiropractic care.
Now, I know you do a lot of work with scoliosis patients. Is this something that can help scoliosis patients as well?
Absolutely. Yeah, the scoliosis patients that I treat, I utilize a combination of chiropractic biophysics. I utilize other specific scoliosis exercises termed CAS, which are scientific exercise approach to scoliosis. The CAS methods, CBP methods, traction methods, CBP plays a large role in how we treat our scoliosis patients. And if we have patients that have a 20-degree curve and they're relatively still in that growth phase, we can treat that type of curve without even having to use a brace, just by using the rehab methods that CBP provides us with. So it definitely helps people with scoliosis.
Let's talk a little bit about those methods. So is that mainly traction, or is it exercises or holding positions?
It's a combination of all that. So we will use a 3-part system of adjustments that are specific to posture and structure. We'll use a series of exercises that are specific to corrective positions for certain types of scoliosis, and we always use tractions for those as well. And we'll use that with any patient that we're going to treat in the office. Use that three-part attack. All these different exercise programs and traction protocols are specific for certain types of structural problems, and so it allows us to move the spine, actually structurally change the shape of the spine from A to B.
Now, you mentioned the young cheerleader that you treated. Can you care for children with corrective chiropractic, or I guess what is the minimum age that you would treat a patient using these methods?
Well, we want to be seeing kids as, from birth on. I can't tell you how many children we've seen in the office that their parents bring their infants to us right after birth, because birth is a rough ride, so there's a lot of things that can occur in the birth process as far as spinal trauma. So, but we're not going to be applying our traditional CBP methods full force like we would on an adult. There are chiropractic pediatric methods for CBP as well. So it's basically going to be mirror image adjustments where we're going to evaluate the child's posture. We're going to evaluate how they're holding their head, how they're holding their body. We see abnormalities. We're going to reverse those positions, use very gentle light force instrumentation and also very light force manual adjustments to correct abnormal posture patterns in infants and just try to keep them as straight and as normal as possible. And then from that point forward, it's just treat them like a dentist would. Just follow them through their life and just make sure their posture and their spine stays as close to normal as possible, so when they get to be in their 20s and 30s and 40s, they've got a spine that's going to carry them through life without having any problems.
So you mentioned something that it's similar to an orthodontist. An orthodontist, a child might wear braces for several years or 18 months to get their teeth straightened out so that down the road, when they become a teenager, their teeth are much straighter. And if they do need braces, then it's a much shorter term. Is it similar with corrective chiropractic, that the treatments you do now help later in life as they grow? Or does chiropractic care ever stop? Is there a start and a stop point?
Well, just like with dentistry, there's no stop to dentistry unless you choose to stop and let your teeth, disintegrate or wear out. So with chiropractic care, what we preach is, get them started young, treat their subluxations, their abnormal spinal positions as early as possible, because it's much easier to fix those things in a child than it is in an adult. And then evaluate those kids every year or so, make sure that their structure is staying as close to normal as possible. And then when they do get into, through the formative years, they get to their teenage years and their spine is going through those growth phases and laying down that new bone, we are going to have a spine that actually has better structure, better function, and is going to give us less on the road. So that's really the big goal, just like with the dentist, just like orthodontics.
Are there any common misconceptions that people have about chiropractic care? Everyone used to think chiropractors are witch doctors or voodoo, but there's certainly enough scientific evidence that chiropractic is a valid treatment option for many symptoms. And are there things that people still think is true about chiropractic care that just are complete myths?
Yeah, there's, one of the things is people think that, why would you go to a chiropractor as a kid? Why would you go to a chiropractor if you're not hurting? Why would you go to a chiropractor, period? I still see these people come through the door. Mostly older people that were around in the 50s and 60s when the AMA had their smear campaign going against us that we actually had to take them to court for, and we won a lawsuit in 1989 against the AMA because they had a committee within the AMA that's sole job was to eliminate chiropractic as a profession, not because we were anti-scientific or we were doing anything harmful to patients. We were basically just boiled down to we were competition. They didn't want any competition. So there's still some people who have ideas, put in their head by the AMA, but, younger generations are coming through the door and they're very accepting of chiropractic. I have medical doctors as patients. I've got dentists. I have a large amount of dentists as patients and hygienists. So as the younger people come through the door, their attitudes about chiropractic are a lot more open because they haven't been exposed to the negative things that older generations have been. But I'll still hear some people that have some weird ideas about chiropractic. They think that I got my degree online, or that I didn't go to school, or whatever. When I've got an undergraduate degree, I've got a 4-year professional degree, I've got advanced degrees past my graduation. So it's very similar to any other healthcare profession you're going to experience.
Well, Dr. Pivonka, thank you for coming on today. I know you've probably got a whole lobby there of patients waiting for you. I certainly appreciate your time coming on today and talking with us about different types of treatment and chiropractic biophysics, something I'd never heard of. Very interesting.
I appreciate you having me on, Ken. Have a good day.
Thanks for listening to Business Innovators Radio. To hear all episodes featuring leading industry influencers and trendsetters, visit us online at businessinnovatorsradio.com today.